What about COVID? So the COVID test also came in. Brace yourself. It came out to be... Hey, I'm Preston.
And I'm Krista.
Welcome to the final video of
chronicling whether or not our cat got the coronavirus during this crazy pandemic. And I think it's finally over.
Yeah, it's been an emotional, draining past couple weeks for us. We honestly thought it would have been a good idea to document it not for ourselves, but hopefully to share with others, because we thought we could still be connected to the pandemic that's happening right now, just because it happened so suddenly.
For this final video, we just want to share some of our takeaways and thoughts from this experience, but also share the long-awaited test results that have finally come in. So let's get into it.
So the first topic that we want to talk about is, of course, the elephant in the room, COVID-19, aka coronavirus. The reason why we started documenting this whole experience is we had a strong suspicion that Waffle caught the virus. At the time, 2 cats in New York tested positive, including 1 tiger, and we got really sick in March, if you've seen in the other videos. We thought during that time, if we'd gotten it, we could have easily transmitted to him. Also the fact that, you know, he just got symptoms so suddenly, we're like, hey, it just has to be it, because nothing else could have explained where all this was coming from. I also want to add that our vet, even on top of her being overwhelmed and having no idea what was happening to her cat, she was also a little bit skeptical in the beginning too. She thought that the timing didn't really make sense to her, and also from her knowledge at that time, she believed that the virus was a pretty weak virus in terms of how long it stayed in the environment. So she's like, the fact that it could have gone from humans to cats, in her mind, was pretty weak. But at the same time, like, really grateful to her, because we were very persistent. We're like, hey, I think there's a strong chance it could have been the coronavirus. Please call them. So we were quite persistent with her, but at the end of the day, it was up to her to make that call and then to really ask them to get the test. So getting the test, we were really lucky. We also found out in our experience that you have to meet officially New York guidelines 3 qualifications. Again, our vet was super helpful in pushing it through. And then going back to the test, it was straightforward, quick one, 2 throats, 1 eye, and it costed roughly about $200, and the results take about 4 to 6 days, so very similar to what humans have to kind of go through. But unfortunately, worst case scenario, our vet said that if he doesn't get better in the next couple days with the initial antibiotic, and then the appetite stimulant, and the anti-nausea, and the hydration, we have to take him to the hospital. And that's unfortunately something that we had to do. That goes into the second topic, hospitals. It was
an ordeal.
It was an ordeal. This was the first time either of us had to bring a pet to a hospital. And I don't know how it is in other parts of the world or the country, but in New York City, it is particularly scary. Number one, the reviews and ratings are horrendous. The reviews specifically are just downright scary. So many stories out there and bringing their pets to the emergency or urgent care only for their pet to pass away during an operation or procedure. And this didn't happen once or twice. This happened apparently many times across all the hospitals that we checked out online. So we decided to pick the hospital that our primary vet personally used for her cats, which was a little bit comforting, had a little degree of validation there, out east in Long Island. So it's called the VCA Referral Hospital in Westbury. We took them there Monday afternoon. It was a pretty straightforward procedure, but a couple of things come to mind about that experience. The first being, it is extremely expensive. We did not anticipate the potential cost of procedures of taking care of him. Ours came out to an estimate of $3,500 to $4,500, which just blew our mind, because I was forecasting in my brain maybe up to $1,000, maybe a couple $100. Boy, was I naive. Boy, was I naive. So that was crazy. And that also reminded me, the other hospitals out there in New York, aside from the horrible reviews, the ones that were also decent had a really bad reputation of price gouging. Like, there were also just horrible stories out there where patients dropped off their pets for a couple days, a week, only to come back to pick them up and get a bill for tens of thousands of dollars. Some of them were a lot higher than that. It was just such a scary experience. Man, I will never forget how we felt, just like frantically researching hospitals online. And I hope we never have to go through that again. But we brought him over to Westbury. We got hit with the cost, which is crazy.
Then subjected to a question we never anticipated we would ever receive, where they asked us, do we have your permission for CPR? What is the CPR code? And
yeah,
I mean,
I asked him, like, what does that mean? And she goes, if he undergoes surgery and he's sedated and his heart stops, do we have your permission to resuscitate him? I was really, really surprised when I heard that question. I'm like, how can you even ask that question to me? Of course the answer is obvious. And I'm like, why are you asking me this? And apparently this is something that, you know, they do with every single patient. You know, we're just very naive and ignorant with this whole hospital experience. This is our first pet hospital experience, so it really just kind of took us back. And I'm like, how are you even asking me this? I mean, if I didn't care about him, why were we here in the first place talking to you? Bring him to the hospital. So that's just crazy. That was just kind of a bizarre experience.
But now we know, if you come to a situation where you have to take your cat or animal to a hospital, or they will ask you for CPR codes.
Yeah, and then we were punted to the doctor, the internist there, Dr. Kimmel. We highly recommend her. Had a great experience with her. She was very matter of fact, and also very, very professional, and just kind of talked us through it. And then they just took a whole slew of tests, like tons of tests, which explains like the significant cost that they projected onto us. Finally, with the hospital, like, you are not obligated to pay what they recommend. So what they give you is, like I said, purely a recommendation. A lot of clients just get the projected costs and then don't do anything and go back home, and then others just choose to a certain degree how far they want to take it.
So yeah, the hospital is very upfront saying you have the choice of either doing all the tests or none of the tests, and it's up to your discretion. And Dr. Kimball, she called us the morning of the procedure, so Tuesday morning, and asked for our consent, what we're open to doing. So we told her, you know, we're open to doing everything, but that's just something also to keep in mind when hospitalizing your pet.
So the whole experience was pretty straightforward. We obviously went through the whole procedure because we love him to death. He's my first cat. He's your... You had 2 cats before, right?
My 4th cat? He's my 4th cat.
He's my cat, aka my son. Love him to death. It was just no question. I'm like, whatever you recommend, we're gonna do it. But what also really, really helped the decision was that he's on health insurance, which was huge. So we use a service called Healthy Paws. If you Google it, they have pretty good reviews and ratings online. It's very easy to submit and get your claims processed. I think due to his age right now and other data point, the policy that we're on, we're paying about $28.70 per month with a $750 deductible and a 60% reimbursement cost. Initially it was 80%, which was pretty crazy. They lowered it to 60 because of his age, but I just can't even fathom going through this whole hospital experience without health insurance to kind of help you with the cost and expenses. So you get processed really fast. They send you a check or direct deposit, and so it's been a great experience. We've been using them since we adopted them, so many years ago. Biggest lesson learned there is have insurance. Whatever you do, whatever pets you have insurance. It's actually not that much, and times like this, it comes in clutch. After the visit to the hospital, he was able to come back home, and Waffle, our cat, got a whole arsenal of medication. I mean, it's a pharmacy in our kitchen. I mean, it's crazy. He's been prescribed 2 antibiotics, 1 antiviral, and he still has to take the appetite stimulant and also the anti-nausea as well. Even a possible IV bag on top of that.
If he was dehydrated.
If he was dehydrated.
But he's been good. He's been drinking his water. He's been eating. He's been a very good boy, taking all his medication, even though Preston has to use a brand new pet pillar to administer cocktail of medicine.
It's a new medical skill I have developed.
Yeah.
I am now confident in my abilities. I will put it on my resume and LinkedIn. I'm a professional pet pillar popper for cats.
I think Dr. Penny will be very proud of you.
Thank you. So if anyone needs help, you can hire me by the hour. But thankfully, since then, he's been on the up and up, slowly and gradually, like Krista said. He's just right here chilling. He would not have done this when he was sick. He would always go to
hiding in our bedroom,
hiding in our corner, and it was just heartbreaking. But he's now spending time with us. He sounds normal. He looks normal, and we're just so grateful. As of right now, and when we're filming this, he finished his antiviral. The last day was today. I think he's a couple days away of finishing all of his antibiotics as well. He's no longer on the appetite stimulant and the anti-nausea, and we didn't even have to use the IV bag. We're gonna say that for me or Krista in case that we get very dehydrated one of these days. It's very great to say that, you know, we can sit here and smile after this whole deal. I mean, it went by so fast and it was rough. Like it was really tough.
I mean, I have like bags under my eyes.
Yeah, we both did. I had trouble sleeping and all that.
Nice.
But the moment has come. The reason why you're here, the reason why we're here, the results are actually in. And before we get to the COVID test, which we will reveal at the end, a whole lot of other results came that we were not suspecting at all. First of which being, he has feline
herpes.
Herpes! Like what? Like when you think of someone really, really ill, like coughing, respiratory issues, herpes does not come to mind at all. What we've learned is feline herpes
is a fairly common illness.
Fairly common
First
illness.
and foremost. Cats can easily contract it from each other, and our vet believes that our cat may have contracted it when he was in the shelter when we adopted him.
Right. You can only contract it from other cats. You can't contract it from humans.
Cats cannot pass it on to humans,
Yep.
so there's no need to worry there. But the issue is that for a lot of cats, it remains latent and they don't show any noticeable symptoms. And then
That's
what
right.
can happen is they can have just random flare-ups, which is what happened in this case.
Right. So feline herpes is different from human herpes. Feline herpes, the most common symptoms really attack your upper respiratory issues. So anything with like discharge, sneezing, wheezing, cats will demonstrate that. And it can also result in conjunctivitis, which is inflammation of the nasal and eyes. And so common discharges will happen there too.
Yep, and you can also notice a flare-up when they start to have a fever. It can be around 104 or 105 degrees. If it lasts for a couple days, you'll notice an extreme weight loss, lack of food, lack of water, and then also depression, where your cat will just avoid you. So these are all things that we had noticed in Waffle when he was sick. And a result of with a cat who has a feline herpes flare-up, their immune system becomes compromised and it's much lower, so they're more susceptible to bacteria,
Right.
which brings us to the next thing, the next issue that he has.
So herpes
Was
the first one. The second is feline strep. And we all know strep, it attacks the throat. It's same thing with cats, it also attacks the throat and again, upper respiratory issues, which is why he just had such a hard time breathing. Having feline herpes by itself is rough. Having that with strep on top of that is just crazy difficult.
Yeah.
And the third is mycoplasma, which is a bacteria commonly found in, again, upper respiratory. So he had 3 things attacking his lungs. And oh man, poor boy. And I still don't know why all 3 of these happened out of the blue at the same time. You know, we suspect that, like Krista was saying, herpes lowers the immune system, so as he gets weak, then he can contract other things like the strep and mycoplasma. But having all 3 at the same time is something I do not wish on any cats, ever. So he really had quite the battle to climb. But thankfully, he's doing much better. The antiviral was for the herpes, and the antibacterial was to kind of battle anything underneath that, any bacteria. So and his mycoplasma and strep, I think it helped that. And we noticed in the next couple days after medication, his voice started coming back to normal.
It's returned.
So, thank God.
And the wheezing has subsided. It's completely gone now. He hasn't coughed or had an asthmatic wheezing attack. He's practically the same baby boy he was before this whole ordeal happened. And then in terms of managing the herpes, if they have a flare-up again, you administer the antiviral as well.
The crazy thing is the whole time we had him, he had herpes and we had no idea. And of all the vet checkups that he's done, they couldn't find this out unless they've done the tracheal wash, which the hospital's done. So if you have cats out there and he or she has patterns of sneezing or discharge, I recommend take him to the vet or the hospital and ask them to do a tracheal wash or really look down deeper in the lungs. He or she may have it. I feel so bad that it took us this long to actually realize that he has herpes, and now we're doing what we can to help him manage the pain.
Yep.
And so herpes 1, strep 2, mycoplasma 3. What about COVID? So the COVID test also came in. Brace yourself. It came out to be
Negative.
negative. Like what? I mean, we are relieved.
Yes.
We are grateful.
Yes.
But we were pretty sure he had it. One of the reasons why we wanted him to do the test is at this filming, Kirsten and I still haven't gotten the official test done, and we thought if he had it, then by affiliation, we can deduce that we have it. We still have no idea if we have it. Now, we don't know if he has it. The doctor has also told us that antibody tests, coincidentally like human tests, are not proven to be completely accurate. There are a lot of cases of false positives, so that's another thing to kind of take into account of. And again, what we alluded to earlier, the timing, the fact that it happened so suddenly. I don't know. I'm like, it has to be more than just a regular bacteria. Like I honestly thought it was like a crazy, the pandemic was really in my mind the only thing that could have connected the dots. But now we know, as of this one test, he does not have it. He has all these other issues, and you know, it's gotten to a point where we talked about in the last video that if he just had COVID alone, it would have been much more of a smooth sailing for his recovery. But now COVID is completely secondary. It's not an issue. We have to kind of shift our gears and help him get over these issues. He also has a possible underlying heart issue as well, which we probably have to follow up with our vet and hospital in terms of what we should do in terms of next steps. But as of right now, he's doing a lot better, and we're really, really happy to be able to say that. We've been honestly really moved for everyone that has reached out and shared kind words and prayers. It really, really meant a lot to us.
Thank you so much.
Even though he's our cat, he does feel like our child. He feels like my son. He is my son, and I can't imagine what life would be without him. So I appreciate that. Krista appreciates that. We both appreciate that.
And we're also just extremely grateful for all of the veterinarian medical professionals who helped us, from his primary vet, the cat doctor, all the vet techs, receptionists. We've taken all of our frantic calls, and then Dr. Penny, who looked over him. Thank you so much for your patience and understanding and helpful care. And then to the VCA Animal Hospital and Dr. Kimmel and the team there. Thank you so much for taking such great care of him. We're really fortunate to have a healthy boy now. Yeah.
And finally, if anyone else out there is going through something similar, we know it's a painful and stressful time. The pandemic, we're finally getting accustomed to it, the new normal for us humans, but for its effects on animals, specifically cats, is relatively still unknown. If you think your pet has the sudden onset of symptoms that could be unexplainable, it could very well be COVID, or it could also be a lot of symptoms that you just never know your cat or dog has, which ultimately happened to us. So please share your thoughts and experiences. We were happy to respond and help out as best as we can from our experience. But we hope that you're able to take something from this. Yep. Pandemic is still happening here in New York. Our thoughts and prayers are out for everyone. Hope that everyone stays strong and healthy. So if you enjoyed this video, please don't forget to like, subscribe, and comment down below. It really means a lot to us, and it helps us out a lot. Waffle is thankful, we're thankful. And with that said, we will see you on the next one. Sayonara! Bye, 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 bye.
Oh, I'll welcome up.
Pops, say hi to everybody. It's like I'm doing better, guys. It's like I'm doing better. Give me food, please, right now. Little boy. Sayonara. Stay strong. Stay healthy.